BRCA1 and BRCA2 are still the most common and the best studied genes, and there are hundreds of mutations in each of them, all of them very strong for breast and ovarian cancer, and now some other cancers as well. But there are at least 15 or 20 other genes that are being studied in women associated with breast cancer risk. Many of these genes are involved in the repair of errors in the DNA, and many of the current drugs target DNA repair defects. So maybe 10 of the others are associated with this. It's difficult to pick which will be the most important, but many of them could be good targets for triple-negative breast cancer in particular, and for others as well. Many women are tested now at the time of diagnosis to learn whether they should have different surgery, perhaps mastectomies instead of breast conservation, and to consider now different therapies. There's a lot of discussion about platinum for women with BRCA1 and 2 mutations. PARP inhibitors are now available in studies to treat women with inherited etiology for their breast cancer. So increasingly at diagnosis. And then, of course, women who are survivors may need to be tested for their own risk of second cancers, like ovarian cancer, to consider having their ovaries removed, and of course for their families. Genetic testing is still complicated business somehow, even though it's only a blood test. In the US, testing is expensive. Insurance does cover genetic testing costs, but it is still not routine, and many physicians don't know as much as they should about genetic testing. It's not so different in Europe, where testing is also available, but actually less available because it is not commercial. It's done by countries in specific labs. And worries about genetic discrimination and misunderstanding of genetic information probably are the most difficult things that prevent our using genetic information for its full power. So certainly women and their families are concerned about genetic information. The options for reducing risk, mostly surgeries and causing menopause early for women as they avoid ovarian cancer, are not popular. On the other hand, if you've come from a family where many women have died from cancer, these may be more acceptable. And I think in general, education is the key for women and for their physicians to try and use genetic information for its benefits and not just for its anxieties.